So what do you do if minoxidil doesn't work for you? Hi, my name is William Gaunitz. I'm the CEO and founder of Evolution Hair Loss Institute. I'm also a fellow with the World Trichology Society and been a practicing trichologist for 21 years. Now, I get a question regarding minoxidil all the time. I do a lot of videos on minoxidil. Minoxidil is a vasodilator. All it's doing is expanding blood flow specifically to the area where you're applying it topically or systemically if you're using it orally. It will not do anything to block DHT, encourage nutritional supply to the hair, or block inflammation. So those are the three reasons for hair loss. If you do not block the underlying reason for the hair loss, minoxidil will have very little effect or no effect, or ultimately may be helpful at first, but then the underlying reason eventually continues to get worse and will drag down the results of the minoxidil. So the solution is identify why you're losing hair. If you are in fact losing hair due to DHT, take a DHT blocker. If you're losing hair due to nutrition, get blood tests, test your vitamin D3, ferritin, zinc, folate, and B12, and supplement for that. Or you can just go ahead and proactively take something like the methylated version of the follow growth vitamin, which can go ahead and block the core reasons for those types of loss. It will not do anything for really intense iron issues or intense vitamin D3 issues, but it's a nice blanket protocol. And if you're dealing with inflammation, you have to correct your gut. And that is something where you need to make sure that your gut is actually working properly so you can absorb proper nutrients and obviously take some fiber, take some probiotics. Those are going to be things that are going to be helpful. If you've got questions, go ahead, put them in the comments. I'm happy to help in any way. And I will oftentimes respond via video, obviously, if you go ahead and leave those comments.